Hi, my name is Gitte Lamunyon, and I'm thrilled to be participating in this Capstone project. I'm looking forward to the completion of our exciting degree. I first started my BSN studies in 1988 at Cal State University, Fullerton. Unfortunately, I had to discontinue my studies due to an addition to our family. Finishing my degree has always been something that I knew I would do. I just didn't know when it would be. I complete this course when I'm 70 years old, and I have learned that age is truly just a number. My goals for this course are many, but most important to me are to utilize and assimilate all of my newfound knowledge in preparation and completion of this capstone project. I look forward to contributing in the workplace with all my newfound knowledge and skills. This is truly something that is important to me. I am a better nurse having had gone through this program than I was when I started it. After the program, I plan on taking a cruise to Hawaii. Hawaii is my favorite place. I have yet to decide what direction I plan to continue my studies, whether it be a nurse practitioner or a doctorate. Thank you. Have a nice day. Bye. Hello again. My name is Gitte Lamunyon. My first capstone project idea was a case from my home health agency who appeared to be starving himself to death in a state without a right to die law, Arizona. After a very helpful phone conversation with Dr. Stagg, thank you very much, I am changing my project from right to die versus suicide by starvation to community transportation and telemedicine assistance for home health patients. As you may recall, I am a home health nurse in rural northern Arizona. Many of our home health patients no longer drive and have transportation problems, and particularly in medical appointments. Some are having telemedicine appointments with primary care and medical specialty appointments and do not have internet capable devices or know how to use them. An agency in my home health service area provides patient transportation and is planning a program to assist seniors and shut ins with telemedicine assistance, including tablets, that volunteers will take into the home and assist seniors and shut ins with their telemedicine appointments. The agency is the Verde Valley Caregivers, and it is mostly a volunteer service. Volunteers conduct activities to ensure clients are regularly visited and stay connected through friendly visits, phone calls, and email buddies. Guardian Angel medical alert units are loaned to nearly 920 households, helping older adults, including connections in case of an emergency like, help, I've fallen and I can't get up. I became familiar with this organization while giving COVID immunizations to seniors and shut ins as a volunteer. My plan is to prepare a marketing brochure about these services and give in service trainings for my home health agency and nearby hospice and other home health agencies about services that are available to them and how to access those services. Home health nurses are engaged in case management, and the service of the Verde Valley caregivers will be helpful for patients, their families, and home health hospice nursing personnel. I have met with the director of the Verde Valley caregivers for more information, including how to access these services for our patients, 1 hour, and discuss the change of project with my supervisor. Next, I meet with the regional's expert on the virtual care from the major medical center in northern Arizona for helpful information about virtual care and a new concept, virtual hospitalization. That was virtual hospitalization. He has referred my nursing questions to an RN in his department who supervises. I am also planning to observe, shadow, and nurse working in virtual care to understand more about the systems and the role of the RNs in virtual care. Thank you. Have a nice evening.
Hello again, classmates. My name is Gitte Lamunyon. I am a home health nurse in rural northern Arizona. My capstone project includes the delivery of an in-service education about virtual care assistance and other no-cost programs in my area for my home health agency. I may also share this information with other home health and hospice organizations in northern Arizona. I found our State Board of Nursing requires a learner assessment, which I plan to accomplish this week at my agency before giving my in-service training at the end of the course. I will post these state board requirements with this video. My project continues to morph in ways unforeseen in the beginning. Thank you for listening, Gitte.
Hello, my name is Gitte Lamunyon. My capstone project was an in-service education to a home health agency about a new community-based virtual care assistance program for older adults. My assessments were a pre-test, a post-test for my presentation, and a feedback survey. I found a gain of 2 points in my post-test over the original pre-test scores. I had all excellent results on my feedback survey, and 2/3 of the staff reported they would use the virtual care assistance programs that I had presented. Despite the deaths of millions of people worldwide, the COVID pandemic has some positive outcomes, including improvement in proliferation of telemedicine services. During the COVID-19 pandemic, wellness calls and telehealth education were found beneficial to support telehealth usage among older adults. Barriers to telehealth include perceiving, seeking, paying for, and engaging in internet-based home care, high payment costs, uneven quality of services, and concerns about privacy and patient safety. The use of telemedicine services saves healthcare dollars and has equal patient satisfaction when compared to in-person medical visits. A pilot project for older adults, medically complex veterans found both high patient satisfaction and increased real-time care coordination. Case management for telehealth was shown to improve patient access, comfort and sense of reassurance, create trusting relationships, and skilled nurse case managers. Medicare Advantage plans are taking credit for more growth than other Medicare reimbursement programs due to having augmented and made available more telehealth services than other Medicare providers. My initial plan was to follow a home health patient who seemed to be starving himself as a means of suicide in the state without right to die laws. I was guided into another project, assistance of older patients with virtual care visits, otherwise known as telehealth or telemedicine. My deliverable was a presentation to the staff at my home health agency about a community-based resource that provides assistance services using volunteer retired nurses. I presented this information to staff at my home health agency on Wednesday, June 5th, with positive results. 2/3 of the staff said they would make referrals to the virtual care assistance program that I had just presented. Future limitations may be in reimbursement for Medicare, Medicaid, and insurance companies. My volunteer hours in week 2 were 1 hour with Kent Ellsworth at the Verde Valley Caregivers for information about the virtual care program, and 1 hour with Administrator Rodolfo Cancel to discuss changes from previously approved death by starvation to virtual care assistance programs. 1 hour with Travis Warren at Northern Arizona Healthcare about virtual care programs in Northern Arizona statewide, and 1 hour with Nicole Bullard about the role of nurses in virtual care. My volunteer hours in week 6 were 1 hour with Travis Warren to review the recent policy changes from the state of Arizona about virtual care and 1 hour during a learning needs survey at my agency. My volunteer hours for week 8 were 90 minutes interviewing and shadowing, monitoring Nurse Nathaniel Tabelin, and 90-minute presentation to home health staff and pre-test, post-test, and feedback survey. I began this BSN degree program, in 1988, however, withdrew due to pregnancy. Completing this program has been a long-term goal. I feel great satisfaction at finally completing this goal at the age of 70. As a result of my BSN degree program, I am now much more likely to use professional literature to answer questions and solve nursing problems. I feel much more qualified to discuss clinical problems from a research basis. Thank you, Gitte Lamunyon.